Amid a worrying spike in heart attack-related deaths in Karnataka's Hassan district, over 20 in the past month alone, Chief Minister Siddaramaiah expressed concern and suggested that the rapid approval and rollout of the COVID-19 vaccine could also be a reason for these deaths. However, health experts and leading research bodies have refuted this claim. The Indian Council of Medical Research, or the ICMR, and the National Centre for Disease Control have jointly investigated sudden unexplained deaths in adults aged 18 to 45. Their findings confirm that COVID-19 vaccine does not increase the risk of such deaths. Scientific experts warn that linking vaccine to sudden deaths is both false and harmful, as it undermines public trust in vaccines, an essential tool that saved millions of lives during the pandemic. Preliminary data from the ongoing study shows that the heart attacks remain the leading cause of sudden deaths in this age group due to sedentary lifestyle and pre-existing diseases. Patterns have remained consistent with previous years, and in many unexplained cases, even genetic mutations were identified as a possible underlying cause.
Siddaramaiah is not a medical expert, and I know that he's a political expert. He politicizes health, he politicizes education, he politicizes administration, he politicizes center-state relations. So his whole life he used to politicize, link the death of the people in Hassan to COVID. His only aim is to divert the whole issue, which is always does that. Divert the whole issue. It is his incumbent duty. Certainly, the health system in Karnataka has collapsed. There are no medicines, timely medicines for critical illness. Siddaramaiah is totally a disturbed man.
Throughout the world and India today, if you see any professionals, any if you meet any of the medical specialists, they would say there is a reason. It's because of these COVID vaccines. ICMR had to, they have to substitute. No, they have to tell what is the reason then. Then what is the reason for? In one district, so many people are facing this heart attack. Throughout India and throughout Karnataka, there so many people are facing, especially middle-aged and young people. Then what is the reason for them? They have to come up with, no? Let them come up with then. If they come up with the substitute answer, then we can agree.
Karnataka Chief Minister is now saying that there are deaths that are happening in his constituency, that is Hassan. He is saying it's because of the centre and the COVID vaccines that the centre pushed Indians to take. Do you believe in this? The government has given clarification. All the reports are saying that heart attacks and COVID vaccines are not related.
No, look, I usually address all chief ministers with a great deal of respect. When it comes to Siddaramaiah, I really have a great deal of difficulty in saying respected Siddaramaiah, because he has taken politics in Karnataka to a level where it is beyond desperation and shamelessness and a politics of lies. He is the chief minister of a state that is rapidly imploding. It is imploding socially, it is imploding economically. There is no money for development.
These kind of remarks about COVID vaccines because they actually save lives.
There is no point telling the Congress government what to say and what not to say. It is like trying to tell the Congress party that you should not have political alliances with the Jamaat-e-Islami. But they will do it because they are desperate, they are shameless.
COVID has affected the entire body with an inflammatory process, and this gradually we have started to learn that it has affected the cardiac system also. Now putting this on the vaccine, I don't think so that is right. Vaccine is created from the virus, the inactive virus or the dead virus, we create the vaccines. Hence, it is not the COVID vaccine, it is the virus itself which needs to be blamed for all these increased mortality in the young people which is happening. And that has been proved by the ICMR.